My name is Ellen JACOBS. I am originally from the Netherlands, but have lived in this lifetime in many different countries. Grew up in Indonesia and lived in plenty other countries. Got married in the United States and have lived for a long, long time in the USA. Yeah.
Currently, you are living in.
Currently, I left the USA 2 years ago, and it really, I think, had to do with healthcare issues. I needed a big operation. I have a full healthcare program in the Netherlands, which covers a lot more than it is in the USA. I loved living where I did, but it was time to move. And right now I'm in Nepal because I'm always involved with social activities. Suffering from knee pain, I didn't know it was osteoarthritis since 5 years and actually longer. But about 5 years ago, I was visiting from the United States to the Netherlands where I have relatives. And I went to a hospital there to an orthopedic surgeon. And I was diagnosed after my x-rays. Both knees needed a full knee replacement.
Okay.
And I just was not ready to think about a full knee replacement and what that means for my body and for later on. Also, the recuperation time is quite long. It will take at least 3 months before I can walk reasonably well. And a lot of times it's fine. Other times I understand it all depends on the body, how, and of the surgeon and all that. So I just had another big surgery and I wasn't ready to face a knee replacement. Eventually I found, through looking online for more alternative ways, that there are in the future possibilities, just as I talked with the doctor about stem cells, but that isn't yet fully developed yet. And I found Dr. Kumar's
Dr. Veeresh Kumar.
Yeah, Dr. Veeresh Kumar's website or his work online, and I did not understand exactly what metabolic treatment would mean. I just came here in trust, thinking, well, what do I have to lose? And I am actually quite impressed with Dr. Veeresh Kumar's approach and how he healed himself. And that to me is always a very important way to go about. Somebody who has healed his own problem. So I'm very happy to be here. And I have here a limited time, about 2 weeks. And I think the doctor already mentioned a lot can be done in 2 weeks for me to be painless and to work. Let's hope for that.
What about your knees right now? Do you feel pain while walking?
Yeah, and I'm a very active person. At the moment, since a year and a half, I'm residing in Kathmandu, Nepal, and I'm often in the mountains where I have 2 big Saint Bernard dogs who need exercise. And so I climb with them up the mountains and go down with them, but then the next day I'm in very serious pain. Even while I'm walking, I'm in pain, but I love my animals, so I go about that. In Kathmandu, I walk everywhere, but now I'm walking very limited because sometimes I can't endure the pain. I am not on regular pain medication. There's not much that I can do for the bone. If I have a backache, I can take something and it releases the backache. But for my knee, I haven't been able to find anything. So I am, according to the specialist in the Netherlands, hardly any cartilage left. I'm bone on bone osteoarthritis. So that is, to me, sounds pretty uncomfortable. Yeah.
By which disease you are suffering from?
Osteoarthritis of the right and left knees, both of them.
Now you are taking treatment from Dr. Veeresh Kumar.
Yes, I do.
What are you feeling now?
Well, I've been here 15 days, I think, 14 days, 15 days.
Okay.
And I also was suffering from lower back pain.
Yeah.
So I think I feel my lower back, there is an improvement. I cannot say exactly what, but I'm sitting straighter.
Okay.
I need to watch it though. It needs definitely to get stronger. I just looked with Dr. Kumar at my x-rays,
Yeah.
and lo and behold, there's 2 x-rays, one before the treatment
Yeah.
and right now one after the treatment, because I'm leaving tomorrow.
Yeah.
And according to Dr. Kumar's vision is that there's 3 components at work. The bone density is increasing. This is the old picture.
Yeah. This is the old X-ray of
Yeah.
Miss Ellen Jacobs. This is old picture. The calcification is here.
Yeah.
Bone density is low, showing at black areas,
Yes.
and cartilage is damaged.
Yeah.
But now in new X-ray, after 14 days,
Yeah.
Miss Ellen Jacobs, there is no this part. 1 minute, take it.
Right.
Because show it.
It is decreasing.
Yeah. This was the older X-ray.
Yes.
Taken-
2 weeks old.
Okay. Taken 4 May 2019. This part was the area of calcification.
Yes.
This part the area of decreased bone density, lack of cartilages. You can show it. And now this one is new X-ray. I am showing to you. You can see the part of calcification. This is decreased. Okay.
Yes.
The area of bone density is increased and the level of cartilage is also increased. But we can see it by shining layers around the lower end of the bones. So it was the calcification, and this X-ray is taken at 17 May 2019. And this is a new X-ray with decreased calcification, and this is old X-ray. So the calcification. It was the X-ray of 4th May 2019. This is the part of decreased bone density, and this is the part of now increased bone density. Okay, ma'am.
Yes.
What you want to say about the patients of arthritis, osteoarthritis, and especially for the patients who have need to knee replacement? What do you want to say about Dr. Veeresh Kumar's MCG Technique technology? Is it costly or not? Is it painful or not?
Oh, it is absolutely not painful. I have been 14 days having treatment,
Yeah.
and the treatment is actually quite pleasant.
Yeah.
For me, the only disadvantage is the weather. It is warm at the moment, and I noticed that. But the treatment is absolutely non-invasive. It's comfortable. I am a little bit surprised. I had not expected this result yet, because I still feel my knees are painful. And as you mentioned, it will take a longer time. So I can, anybody who is considering to get surgery, or actually non-surgery, this is definitely a good way, but don't expect results in one day or in 1 week. It takes time, but there are possibilities of healing. So I will have to come back for the second round.
Okay, ma'am. We will wait for your second round treatment. Wish you all the best.